serve. Although nurses and representatives of the unions have held several meetings and discussions with the Cook County Health Systems Board regarding their preparations for that pandemic, nurses throughout the county system still do not have the H1N1 masks that are needed or other preventative protocols necessary to prevent the spread of infections. Nurses at Cermak Health Services haven't received any masks yet, in spite of their close proximity to an already vulnerable population, the criminal county inmates. While the hospital struggles to regain its accreditation, which it lost in 2006 due to budget cuts and a lack of electronic records, the CDC has already recorded that over 220,000 hospital stays were associated with the H1N1 virus. The systems board is moving forward with the layoffs in spite of their own budget review analysis, which show huge revenue gains for the fiscal year of 2010 due to increases in federal funding and additional revenue from the increases in Cook County's retail tax of 0.5%. The Cook County Health System already suffers from short staffing, as nurses and other medical staff are struggling to provide medical care to county residents, which is evidenced by our long wait times that you already experience in our emergency rooms, as well as delays in the care on the inpatient units. In a few days, the National Nurses Organizing Committee will release a patient care report that highlights the staffing problems within the Cook County system. These layoffs will also increase the county's unemployment rate and the uninsured or underinsured population that will need these critical services. According to the interim Chief Operating Officer, Tony Tedeschi, these layoffs of frontline medical staff, the nurses and the doctors, are projected to save the system approximately $60 million in the fiscal year 2010. What these cuts don't reflect is the cost to human life. This is why the RNs of NNOC, the Cook County RNs, are speaking up to advocate for our patients and the communities that we serve. As healthcare providers, we are concerned with what these shortages and cuts in services would really mean to our patient care. We would like to encourage all of you to call the CEO, Mr. Foley, 312-864-6000, and to attend the town hall meetings and contact your county commissioners. Thank you.
Press conference. This is to let everybody know that as a coalition of unionized trades for the building trades, we are totally opposed to this archaic way of laying people off and attempting to take away the services of the people of Cook County. We're the second or third largest county in the country, and yet at a time when people need it the most, they want to eliminate jobs, union busting. This isn't Texas, this isn't Florida, this isn't Kansas. This is Cook County, Illinois. And there's a union movement here. Our will not be broken. We have contacted the commissioners. We have contacted the president of the board. As you know, the county board, hospital board didn't even notify the commissioners or the president of the Cook County board that these layoffs were even in fact going to happen. He had a duty of fair representation to notify us and the county board members. They failed to do that, but yet Mr. Foley continues to collect his six-figure salary along with his multi-million-dollar contracts for private contractors to do consulting work with no minority participation whatsoever, no bidding or anything. He has yet to return our phone calls. We have an unfair labor practice being filed against them because they would not even allow the unions to be present at the notice for layoffs. They in fact laid off the wrong people. They notified people with 15 years of service. This man has no business doing what he did, and I stand with the president to stand with all the commissioners, and all these commissioners, 17, should be taken to task and put this guy under the fire next week when they interview him to find out what's going on. Because we're not going to be moved. We're here to protect the patient, protect the people of Cook County.
Hi, my name is Emily Young, and I'm with the Doctors Council, SEIU. We represent the doctors here in the county system. The doctors who are here because they believe in the public system. This is a great place for doctors to get trained. They believe that their patients should get the best care. In addition to their oath, they believe in the mission, which, by the way, in case anybody didn't know, the mission is to serve Cook County residents with dignity and respect regardless of ability to pay. This is not a corporation that has to be shrunk in the name of efficiency. And our doctors are not going to stand by while their patients are farmed out to private clinics, private hospitals, and so-called hubs where they're not going to get the kind of care that they're getting in the community. So we're gonna fight this, and we're gonna hope that that people will stand with us because we think the money is there. We think this can be done. They can.
My name's John Spurles at the Painters Union. I've been listening to a lot of what's going on, and it's what's going on with the public health service in Chicago and Cook County. It's being directed mainly at poor people and minorities. Well, let me tell you, in the coming months, and maybe the coming year, hopefully it won't be, this is affecting millions of people. People are losing their jobs. It's not just low-income people. There's middle class. There's upper class people that are losing their jobs and their ability to pay for health insurance. I have a neighbor, lives in Arlington Heights, and had a pretty good job. Lost that job about a year ago. Ran out of health insurance because they couldn't pay for the COBRA payments. You know where he came? Here. Testicular cancer. All right? Not a good thing. You know what? Right now, he's in recovery, he's doing great, and he loves this place. All right? So it's not just low-income people, it's all people. And let's take care of all people and put the funding, put the people back to work, and let's get it done.
In the city of Chicago, and I want to first share with you that I'm a proud product of Oak Grove Gardens Public Housing Development, and we have utilized, when I say we, meaning me and my family and many others standing around here, have utilized these hospitals. And I've also was born here at Stroger Hospital, which was formerly Cook County Hospital, as many of us were. And I'm here to say today to the board that there are no more cuts. Patient care should be first. Patient care and the patients of this great county should come first. Patients 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 first. I'm also here to say to the county board that they should be expanding public services and not cutting public services. What's going to happen to those patients on the south side of Chicago that do not have public transportation accessible to them? Who's going to get those individuals to the hospital? How are they going to be treated? How are they going to get all the way down here to Stroger Hospital to receive their needs taken care of? So to the hospital board, I say to you today, no more cuts, put patients first. No more cuts, put patients first. No more cuts, put patients first. No more cuts, put patients first.
We're the ones that's there. We know what's going to work. We know what's not going to work. No one ever asked the frontline people. It's all the people, always the people in their ivory tower who doesn't come down. They don't know what it is we do. They can't tell you.
And who are you?
Oh, I'm a nurse from one of the South Suburban clinics.
That's getting service cut?
Yes.
Did you get a layoff notice?
No, but we're one of the ones that Family Christian wants to take over, Robbins Health Center, Robbins, Illinois.
So it's more than just the two targeted hospitals?
It's the outlying.
Because that's all we keep hearing is
the outlying clinics. They're getting rid of the people in the hospital to make room to move the clinics into the hospital, but at the same time, they're going to get rid of those clinic nurses.
There's a lot of outsourcing and privatization like she's talking about. Family Christian Health Center wants to take over a publicly run clinic that's in our communities out in Robbins. And just like in all the other facilities, even here at Stroger, some of our services they want to take and give it a rush. But they're not telling everyone that there are a lot of people in that systems board that have a very vested interest to make sure we lose services within Cook County and that it goes to their facilities. Ansel and Betts have a relationship with Rush Presbyterian, which is where they would like to move our peds and neonatal and our OB services. And we also have the concern with some of the other OB services going with Sister Sheila has a relationship with Mercy and the Catholic chains. So these people that sit on this board have a very vested interest to have us lose our services that takes care of the public community and send everyone to a private facility where they're going to try to build and make more money. And these hospitals don't take care of our patient population now. Like they said earlier in the press conference, we get a lot of patients that come in through the ER rooms and they come with their prescription pads, they come with notices, they come with their CT scans and x-rays being sent directly from these hospitals that do not want to spend the funds to take care of this patient population.
Surely when the profits increase for all the hospitals, the services will be better.
You said what?
Surely when the profits increase the service will decrease. It's just the way it goes. It's a direct correlation.
Okay, well, I hope it get better for everybody.
We do too. Thank you.
Okay, take care, ladies.
All right.